Good morning. My name is Dr. Gloria Ani-Asamoah, and this morning we'll be talking about diabetes mellitus and its macrovascular complications. Diabetes mellitus is a metabolic disorder characterized by persistently elevated blood sugar due to absent insulin production, a decrease in the amount of insulin that is produced, or a resistance to the insulin that is produced by the pancreas. There are two main types of diabetes, that is type 1 diabetes and type 2 diabetes. In type 1 diabetes, there is absent insulin production, whilst in type 2 diabetes, there is a decrease in the amount of insulin that is produced or a resistance to the insulin that is produced, or both. Diabetes is characterized by several complications which have been grouped into macrovascular complications and microvascular complications. The microvascular complications are the long-term damage seen in the small blood vessels of the eye, the kidneys, and the nerves, whilst the macrovascular complications are the long-term damages that are seen in the larger vessels of the heart, the brain, and the peripheral vessels. This morning, we will base our discussion on type 2 diabetes and its macrovascular complications. The macrovascular complications are as a result of long-term damage in the lining of the large blood vessels. These damages causes a deposition of substances such as cholesterol in the vessels. They keep on being deposited in the vessels until they narrow the lumen of the vessels, and hence there is poor blood flow to the organs that need them. Also, there's a decrease in the production of important substances such as nitric oxide, which is needed to keep the blood vessels patent and allow smooth flow of blood, and hence there is poor flow of blood to the organs that need them. There are several other risk factors also associated with this macrovascular complications. This include hypertension, high blood cholesterol, and obesity. How do these patients present with? Some of them may be asymptomatic, that is, they may not have any symptoms at all, but fortunately some will also come with symptoms. For instance, for those with poor blood flow to the heart, they may come with some chest pain, difficulty in breathing, or dizziness, which is worse on activity but resolves with rest. But with time they realize that this never goes away and it is always there. Finally, they develop what we call a heart attack, which can be very fatal. When there is a decrease in the blood flow to the brain, patient may also occasionally have some symptoms such as dizziness, impaired vision, weakness in walking, weakness on one part of the body like the face, the arm, and the leg. This sometimes resolves spontaneously with no deformities. However, when this continues and the blood vessels are completely occluded, they have what you call a stroke. In patients with impaired blood flow to the peripheral vessels, they complain of pain in the calf, pain in the thigh, pain in the buttocks with walking. When they rest, this pain gets so much better. However, with time, the pain is present at all times and even when they go to bed, such that some of them will have to hang their legs by the side of their bed to relieve this pain. Some may notice skin changes, they may notice recurrent ulcers on the leg, and finally the leg just dies off because there's no blood supply to the leg at all. Then we have to amputate the leg, leaving this patient with disabilities and a poor quality of life. How do we prevent these macrovascular complications? Early screening and aggressive intervention is the way to go. Patients need to see their physician so that these diseases can be picked up early and managed appropriately. Management involves lifestyle modification, where we encourage people to eat balanced meals such as foods that contain less carbohydrates, less fat, more vegetables, more fruits. We also encourage them to do physical activity, at least 150 minutes a week of aerobic activity is so helpful. Stop smoking if you do smoke. Patients need to bring their blood sugars down. Patients are said to be able to reduce their risk of a heart attack by 14% if they are able to reduce their hemoglobin A1C, that is your average blood sugar, in a period of at least 8 weeks by 0.9%. Patients must bring their cholesterol levels down, that is what we call the low density lipoprotein, that's the LDL cholesterol. If they're able to bring it up by 100 milligram per deciliter, they will reduce their risk of these complications. In the same line, their blood pressures must also be reduced. It has been said that patients with a high risk for cardiovascular diseases especially men above 50 and women above 60, must be put on some daily dose of aspirin. Diabetes is a disease with significant morbidities and mortalities. Early screening and intervention is the way to go. Thank you.